In conversation with Dr. Rohit Kumar and Dr. Amna from International Modern Hospital. We've got a message from Dawood, and he says that he has a friend with a question, and he is overweight with 115 kilos, height 180 centimeters, and he's 37 years of age. He wants to reduce weight but unable to do due to physical activity, severe back pain issues, and sciatica. Since 3 years, he doesn't eat. I hope I pronounced that right.
Wrong.
Sciatica.
No,
That's fine.
it's sciatica, right?
Right.
All right. So he doesn't eat a lot, so already on controlled diet. And how do we help with reducing the weight?
So his BMI is already 35. So सबसे पहले we should go for a natural way in form of injection or a balloon. Movement is not much. We'll inform him in advance that later on once we stop the injection or we balloon get dissolved, he may gain weight again. So if this doesn't work, because this we can try for 3 to 6 months, then he should go for a surgery in the second phase. So injection we should try, which is weekly. Take it, do it for 2 3 months. If it doesn't help, most likely it will help him in losing weight, and when he loses weight, his physical activity will increase, and his sciatica problem will also increase. For sciatica, he should consult a doctor, because that can be one of the reason he's not moving around. If it doesn't work, and then we can think of putting a balloon, which is like a capsule. He will swallow, and we'll ask him to drink a glass of water. The capsule will go inside, and then capsule will become a balloon in the stomach. It occupies a space for 3 to 4 months, and then it gets dissolved and comes out. This will help him in losing around 10, 15 or 20 kg, which is good because he is tall. 180 centimeter means almost 6 feet. And on 6 feet, if he is around 80 is a good weight. If he comes down to 90, 95 also is not bad. So that will be the ideal for him. If both these things doesn't work, then the last option we keep is to go for the bariatric surgery, which is a keyhole surgery. Do a sleeve gastrectomy, cut the stomach and make it small, which will be a permanent cure and long lasting.
Superb. I hope कि आपके दोस्त को मदद मिली होगी इस बात पे. And yes, if you want any consultations, you can always call Dr. Rohit Kumar, book a consultation as well at IMH International Modern Hospital. The number is 04406 3000. Also, you can log on to drrohitkumar.com.
Right. And Dr. Amna, are there any myths around weight loss? Because, for instance, if you're on a diet and you do it by yourself, and through all the DIY methods, everything that TikTok brings onto the table, and you're trying all those diets, but suddenly after you stop those diets, you gain a lot of weight, and this is kind of a demotivation factor. It's very demotivating when you start gaining weight after after you've tried to be on a weight loss journey. Any myths around weight loss that you'd like to bust?
It's more of a yo-yo phenomena that happens because our body is not used to certain changes which we inculcate suddenly in terms of diet and exercise. Yes, everyone will lose weight when we go on an intermittent fasting or diet. Maybe not as fast if we take any help of an injection or any other method, but if we try natural weight loss. So first thing we should keep in mind is that we will not be reaching the ideal target very soon, especially if we talk about females. There are a lot of factors that play role in terms of the age factor, the gender, and then the third thing comes is whether you have any metabolic abnormalities in your body, in terms of whether you have diabetes, whether you are in a pre-diabetic state, or whether you have a genetic tendency of gaining weight or it runs in your genes, or you have any underlying polycystic ovarian disease, or you are having a high cholesterol. So this all you cannot sit home and know about yourself. So it's good to take a good portion of your meals, and you can do it by yourself by taking high protein meals, low carbs, but it is always good to take a help of at least a dietitian. Like we have a dietitian at our hospital, and Dr. Sapna, she is good, and we generally recommend even normal people, not like they are patients, but if someone asks for a dietary consultation, like they don't know what kind of diet they should go, or what portions or how much energy or calories they should take. So she gives them a good chart, and along with diet we should focus on physical activity. So when you do exercise or you do diet and you leave any of the two, again you will gain weight. That's a normal or natural thing. So this is something that you should make a lifestyle and you have to continue. And you will lose maybe slow, but it will be slow and steady. And once you reach the target, then try to maintain it.
और
Right.
संदीप ने हमें वॉइस नोट भेजा है, हम क्विकली उनका सवाल जो है वो सुन लेते हैं.
Hey, good morning, guys. Good morning, Dr. Rohit Kumar. Really, every Thursday we enjoy your show and we get a lot of information, medical information rather. I have one query regarding my son. He's 21, going to university. He's also 6 feet 1 inch probably. So, but his weight is not increasing. Anything that you can suggest me, doctor? I really appreciate.
Weight is not in.
As I'm driving, I could not call, so I'm sending this message by WhatsApp. I hope. Thank you.
That's a common issue with some group of parents, that the child weight is not increased. That typically goes with the genetic the child has,
Okay.
and the metabolism someone has. Like we have someone sitting in front of us. He never gains weight, and someone standing here in this corner. So we are the one who eat little.
क्योंकि हम स्ट्रेस बहुत लेते हैं तो वेट
Really?
अपने आप बर्न होता है. Right.
So you cannot change the genes and the metabolism of the person, but yes, going to the gym and doing a weight training and going on a high volume diet, which we call it the bulking high calorie diet, will help in gain the weight, which will be like when you're breaking the muscle will start developing and your intake increases. So that helps in gaining. This group of patients, or I'll not say people, are benefited by doing gym weight training.
Weight training will help you.
Yes.
संदीप, I hope this helps you as well. हम weight loss से शुरू किए, हम weight end पे end कर रहे हैं. We will discuss more. Really very kind of Dr. Rohit Kumar to answer all different kinds of questions. So thank you so much for that. एक सवाल आया है कि IV hydration drip काफी fashionable भी हो गया, बहुत लोग लेते भी है ये. How does it work and is it safe?
It's safe. What happens is it's same thing what we do. Multivitamin, they give IV fluid and उसमें different types of vitamins and अलग infuse करके आपको देते हैं, and that is also a way of taking it IV form, which gives you little boost in your energy and everything. It's up to you. You want to go for the IV or a tablet. Ultimately, physical. If you are active and physical exercise you are doing, your intake is good. Some support with the micro elements like multivitamins, all micronutrients, detoxification, antioxidants, all these support.
Superb, yeah.
Right, and I know we're talking about weight loss, doctor, but then where children are concerned, I think it begins from there. At what age, Dr. Amna, must we bear in mind with our children, and we should start keeping a tab on their weight as well?
Weight, like
Obesity.
we are talking about
Yeah,
obesity,
yeah.
right? Yeah. Generally, we should keep a check once they are around 7 or 8 and above. Yes, because that is the general age when they go to these grades of primary, grade 1 and grade 2. And ideally, up to age of 3 years, the baby fat should have been shed off, because that's the time the children have already learned walking, and we should let them play as much as possible. But nowadays, these schools, they are actually promoting a lot of physical activities in the children, so we should keep an eye and a watch by inquiring, or from the teachers involved, that how much your kid is involved in that physical activity, what is the actual diet that they are taking, and we should keep a check by monitoring that they should not gain weight and they should not be having a sedentary lifestyle. And once we are onto it, I am sure that they
And I
won't
think
gain it.
as a parent, you should lead by example. You should be more active and encourage
Yes.
them.
True.
Dr. Rohit Kumar, fantastic discussion. मुंजारो इंजेक्शन से हमने स्टार्ट किया था, मुंजारो से. Quickly summarize अगर कर सके आज का सेशन.
Yeah, Munjaro is there, something new. अब तक हम बात करते थे कि weight loss, exercise, injection, surgery. Now Munjaro has come, जो कि आपको weekly एक बार लेना है. Comfortable to use, results are good. New drug, and should go for it if it helps you in weight loss. Natural is the best way. Going for diet and exercise in a natural way. In fact, if you do a good weight training, you can eat a lot. problem arises, we want to eat a lot, but we don't want to do exercise.
Right.
That is there. Then balloon is there to help you in losing weight. If nothing works, the last option is to go for the surgery, for which we are there to help everyone.
So imh.ae पे log on कर सकते हैं. And quick word from Dr. Amna.
Just a word for the children around us and our own kids, that we should keep a check and do not try to add any artificial thing or an extra thing just to make them obese or fat, because as Dr. Rohit said, genetic does play a role, and we should just give them a healthy diet, keep them as active as possible, and that is what we need from them. That's it.
Super. For more, you can always log on to imh.ae या rohitkumar.com. सुनते रहिए टॉक 100.3. बहुत बहुत शुक्रिया and thank you so much.
Thank you.